Association's national webinar, Promoting Mental Health During COVID-19. My name is Chris Karlitz, and I'm the Director for the Center for Workplace Health at the AHA. On behalf of the Center and my colleagues in Workplace Health Solutions, it's my great pleasure to welcome you and our distinguished speakers. We live in unprecedented times, and as we all know, COVID-19 has significantly disrupted our normal way of life. We are very fortunate to have three experienced national leaders with us today who will share their thoughts, experiences, and recommendations for navigating these challenging times. And they are Dr. Eduardo Sanchez, the Chief Medical Officer for Prevention at the American Heart Association. Eduardo is also the Chief of the AHA Center for Health Metrics and Evaluation. Darcy Gruttadaro, the Director for the Center for Workplace Mental Health at the American Psychiatric Association's Foundation. And Dr. Jennifer Posa, the Global Head of Employee Mental Wellbeing and Workplace Effectiveness at Johnson & Johnson. Johnson & Johnson is a member of the AHA's CEO Roundtable, a leadership collaborative comprising 46 CEOs from the nation's largest companies that have joined forces with the American Heart Association to develop and broadly adopt evidence-based workplace health solutions. So Eduardo, Darcy, and Jennifer, welcome to all of you, and thank you so much for being with us today. A few housekeeping notes before Eduardo kicks us off. As Carrie-Ann mentioned previously, and I'll just repeat again, this webinar is being recorded, and the slides and the resources will be made available after the event. It would be really great if you can send us your questions during the webinar in the chat box so that we can answer those during the Q&A session. And so without any further ado, I'd like to hand over to Dr. Eduardo Sanchez. Eduardo?
Good morning, everybody. Good afternoon. Really a pleasure to be a part of this discussion and a conversation about an aspect of COVID-19 that perhaps isn't getting as much attention as it could or should. We hear about the virus and its effects on physical health. We hear about the effects that it's having on the economies of the world, including the United States. We're not hearing so much about mental health. We are hearing some. And last night, as I was turning the TV off to go to my bedroom, I saw a NAMI PSA, "It's okay to not be okay," which really, to me, served as the reminder that, we were going to talk about this today, and that there is an aspect of COVID-19 which needs a whole lot more attention. Last week, the New York Times had an article about how coronavirus has taken a toll on mental health. It mentioned stress, loneliness, touch deprivation. We're not hugging, we're not shaking hands, and talked about telehealth and legislation. And around solutions, which I will talk about again in a minute, in the article, one was about finding routines, controlling what you can control by having a routine around staying at home, and also leaving the house, whether that's just stepping outside, if that's all that's possible, or maybe going for a walk. And then just this morning in the Dallas Morning News, interestingly enough, there was an article about, not an article, op-ed, "Pandemic Threatens Our Mental Health," talking about increased anxiety, depression, addiction, and other psychological trauma, and reminding us that we've had the experience of large mass events like 9/11, like large, big hurricanes that have resulted in increases in depression, anxiety, domestic violence, child abuse, that even persists beyond the event itself and the immediate, the time immediately afterwards. So there's no doubt that we are in a new reality. And that new reality is one of masks, one of closed signs that are beginning to look like open signs, but certainly concern about what are we walking ourselves into and worry about what might be facing us as we ponder going out and braving this new world. Next slide. I don't know if any of y'all have heard the term infodemic, but the idea of an infodemic is while there is this epidemic of a disease that is amongst us, at the same time there is an epidemic, a large amount of information coming our way, some of which is not so good, some of which is not so informative, and some of which is guiding us the wrong way. And you can see some headlines here, but interestingly enough, we've had the challenge of trying to figure out if the person who should be the trusted messenger or the trusted messengers are delivering trusty and credible messages. And so the infodemic gets even more complicated because generally there are certain types of people who are the credible messengers. We hope those of us on this call, and I'll take on this webinar, I'll take a moment to thank my co-panelists for being a part of this. Hopefully we are seen as credible messengers. Next slide. At the American Heart Association, one of the things that we've been doing is tracking COVID-19 like everyone else. But what I want to share here is that we've written AHA is a trusted source of information that's been tested. We are seeing around all of our different communication mediums a lot of attention and a lot of focus and a lot of interest in what the American Heart Association has to say. Among our audience is our own staff, and we've been sharing information with them, looking at the regional distribution of COVID-19, because we are a nationwide organization. We divided ourselves into regions. That's been really helpful because when you track by state, you can get stuck in sort of the 1/50th. But when you track by region, you start seeing, as this demonstrates, I'm not going to ask you to look at it, but what I will suggest to you is that for the last several weeks since we've been really tracking COVID-19 with big numbers, the eastern states of the United States have really been bearing the brunt of COVID-19. 60% has been where it had held, and over about the last 7 to 10 days, that number is beginning to go down. And what we're beginning to see, which all of you are experiencing either very locally or at a state level, is an increase in activity in other states as a percentage of the overall activity in the country. The Midwest being the one that's seeing the biggest uptick compared to where it was 7 to 10 days ago compared to the rest of the country. Let's go to the next slide. So as I mentioned earlier, we might have even been able to predict that there was going to be a certain amount of mental health distress during this time. And so let me just define a little bit that one of the protective characteristics around stress and increased mental health distress is resilience. And resilience, as probably all of y'all know, is the ability to withstand, recover, and grow in the face of stressors and changing demands, which by definition is what's going on with COVID-19. If it wasn't enough to be fearful of disease, there's having to stay at home and the stresses associated, not so much with it's a bad thing to be at home with family members, it's just not the thing you're used to. And even that creates stress. And then the other is the economic effects that it's having on some of the families that we know, maybe your own family, as well as the economic effects that we can see going on in our communities by reading the newspaper, by just looking around if one is getting out and about and walking around, obviously well protected. It turns out that people who have resilience can better cope with stress, remain calm, manage their emotions, guard against a burnout, and remain productive. And resiliency has both physical and mental aspects. Next slide. So So we've been talking about some resiliency within AHA and to external audiences, and trying to promote trust, connection, and just help people. So the AHA has been putting on weekly virtual town halls with staff attended by 85, 90% of all employees at AHA, to provide them not only updates on COVID itself, but how it might affect their professional lives and even their personal lives. We've made available a daily virtual physical activity session. It is pretty well established that incorporating physical activity into your day helps with resiliency. Regular communications about tools and resources that are available to our staff and sometimes to others for boosting mental and physical health. We as an organization have been funding research initiatives that are really about the science of COVID-19 infection. But I would say to you that our employees, myself, there's a great sense of pride that comes from knowing that our organization is relevant and making a difference. And then lastly, one of the things that we've done to be relevant is we've created an employee resource group for parents, people, those employees who are staying at home, and trying to provide content and the ability to come together and share what it is like to be trying to figure out what to do as an employee and a parent, and trying to do both things as well as can be done at the home. Next. Oh, I'm done. I didn't realize I was finished. So, so that brings my stress level down a great deal. And so now I'm going to hand this off to Darcy Gruttadaro, who's going to talk about the Center for Workplace Mental Health. Thank you, Darcy.
Great, thank you so much. And you can go to the next slide, actually. Thanks. It's great to be here. And I just wanted to say thank you to the American Heart Association. You as an organization have done a tremendous job working on mental health issues, and it's been great to work with Chris and team. So really happy to be here. And I thought I would just open up with the obvious, which is obviously the world looks quite different today. And the good news, the very tiny, tiny silver lining to this pandemic is that mental health is really taking center stage. As Eduardo mentioned, there have been more and more media stories, and there are more and more reports coming out from national surveys, global surveys showing that mental health is really growing in concern. So I think employers stand in a terrific position to make a difference. As they were before this struck, we work with organizations of all sizes, and we've been really impressed with how much they've really jumped into the mental health space. So we're happy to be building on it. We're just sorry it's under these difficult circumstances. Next slide, please. And I also want to state the obvious around extreme high levels of anxiety and stress. The uncertainty really continues around things like, when will this end? Will people's health be compromised? What about their loved ones? Will they lose their jobs? A lot of fear around those who may be employed and happy to be employed, but now feel like the economic downturn is something they can't predict where that will go. People were worried about finances, juggling kids. I thought that picture Eduardo had up of the dad with the child really working on homeschooling is something that so many are facing. And really, how do I stay healthy and productive while I'm stressed and extremely distracted? So next slide, please. And the impact is obviously very high. This sustained fear and anxiety is causing people to have depression at high rates. We know the economic downturn, the headlines are really dire around, greatest job loss since the Great Depression. There's a real sense of collective grief and loss, not just for those loved ones we've lost to the virus, but also a loss of the lives as we knew them and as they existed, the loss of our ability to connect with others, and that's the physical distancing part. We're human beings. I mean, that's how we communicate often, is to really shake hands, rub someone's arm, give someone a hug. The social isolation of not being able to connect with those you're so accustomed to seeing, whether it's in the workplace, on Main Street, at your favorite business, and the disruption is just really, really difficult. And mental health is taking a big hit over this. So we're all really worried about this. I think this picture of a city street that's empty is really emblematic of some of those big concerns. Next slide, please. So who is really, what's at risk and who's at risk? And there's kind of three groups we've been thinking a whole lot about. The first is those that are developing a mental health condition for the first time, or they may have slightly had one but not really been aware of it, and that is depression, anxiety, substance use, PTSD. And the real worry here is the younger age groups. When you look at the research on 18 to 25-year-olds, when it comes to depression, their rates are much higher than those in older age groups. So we're worried about young people especially, but we're basically worried across the age spectrum. Then there's those that have had a condition and really were worried about it worsening considerably. So in that case, we really want to be thinking a lot about access to care, because in this country, accessing mental health care is very difficult, and I'm going to talk a fair amount about that, how employers and employees can get much more active in that space. And then there's also those that have been living in recovery. There are many people who manage their mental health issue, their addiction issue very well, and they've been living for years in recovery. And they are really worried about relapse, because all this disruption and all these difficult life circumstances can cause people to relapse very easily. So that's very destabilizing for so many. And again, access to care is critical there as well. Next slide, please. So I did want to show, next slide, please. Thank you. I did want to show a little bit of data. And again, the Kaiser Family Foundation has put out some good data. There's more and more data coming out now in research that's being done. This was a national survey done by McKinsey & Company. They really looked at anxiety and depression across two different groups, all respondents, and then those that experienced job reduction or job loss. And this is really solid data showing that when it comes to both anxiety and depression, that's at about 63% of their respondents, of all respondents, expressed real concern about anxiety and depression. Whereas those that had job reduction, because many are being furloughed, they're losing their full job time and responsibility, or those that have lost their job, the rates are considerably higher at 74%. And I thought these two quotes adapted from the McKinsey report were really spot on. Mental and substance use disorders stem from economic hardship and are drivers of lower productivity, increased healthcare costs, and higher mortality. We knew before the pandemic that depression can be very costly for the workplace to the tune of about $210 billion annually, half of which is healthcare costs, direct healthcare costs, and half of which relates to productivity, so absenteeism and presenteeism. And then when we look globally, depression and anxiety have an estimated cost to the global economy of $1 trillion in lost productivity. That's from the World Health Organization, and that was true before the pandemic. So we can count on the fact that those numbers are very likely to go up and really be very concerning to employers. Next slide, please. So we have been thinking a lot and talking with employers about what is it that they can do. And we've created this framework based on a lot of what we've heard from employers, a lot of what we've heard from employees, what we've heard from the provider community and health systems. We've created this framework that is LEAD. Next slide, please. And LEAD in a changing world really stands for leadership, effective communication, adapt to change, and double down on access. I'm going to address each of these. These are really proactive areas that employers can work in. When it comes to leadership, it's probably obvious to those that are participating today that people need a lot of reassurance. And obviously, it's difficult to reassure people when you're living in a time of uncertainty. So what's really important is for leaders of organizations, business owners, C-suite level, supervisors and managers at the highest level, to let people know it's okay, we're doing everything we can, and to normalize what people are experiencing in terms of anxiety and depression. And we understand that this is a really difficult time and stress level and anxiety are high and you're juggling a lot. Really showing empathy. These times are hard. These are hard for all of us. Leadership that can show a little bit of vulnerability, it's really helpful because it allows people to feel settled in the idea that they're experiencing it too. And then lastly, making mental health visible. Using the mental health language of, this is really stressing our mental health. Many people are feeling depressed and anxious, and people are turning to substance use as a way to quell some of what they're feeling. Really speaking that language, and I might throw in the fact that May is Mental Health Month, so it's a perfect time to really be verbalizing some of that important language around mental health in the leadership role. In terms of effective communication, this is about routine communication out to those that are working remotely and those that are essential employees on the job, in vulnerable positions, interacting with people and placing their health and well-being in jeopardy. It's just really speaking to them on a regular basis, listening to them, being available, giving them a venue to share what they're experiencing and what they're feeling, and being a trusted source. I love the way Eduardo opened up about the fact that the AHA is priding itself on being a trusted source. That's really important to people because there's so much noise out there and people don't really know who to turn to. Adapting to change, think about policies and practices. Obviously, many of you are running a business and it's really important to meet customer expectations, your projections. You want to meet your business, the demands of your business, but at the same time, we have to recognize people are severely distracted. So really setting expectations that are reasonable while still meeting your goals and really thinking about how do we do that in new ways with new policies and practices and having some flexibility. I'm going to talk a little bit more about doubling down on access because access to care is absolutely essential. Prevention is key, really thinking about prevention now as people are really in the throes of this pandemic, but also in the days ahead as we begin to transition back to work. Think about support and what that looks like. Is that employee resource groups? Is that peer support groups? What does that look like in your organization? And then your employee assistance program, and then I'm going to turn to mental health and substance use care through your health plan. So next slide, please. When it comes to prevention, these are very proactive things you can begin doing right now. First is to share signs of common mental health conditions. What are the common warning signs of depression? What are the common warning signs of anxiety, substance use, trauma and PTSD? Those common warning signs are on our website. They are on many websites. So really think about sharing those in emails you're sending out, kind of blend them into newsletters, routine communications. Let people know by promoting early access to care. If you're experiencing any of these warning signs, now is the time to get help. Don't wait. It's important to get help as you would for any health condition early. Really share stress management strategies. What do those strategies look like? What is it people should be doing to help manage their stress right now? Whether they're in an essential role position or whether they're thinking about transitioning back. Promoting resiliency, I think the American Heart Association resource on this is excellent. The report they put out, we turn to often, is really well done. Then think about employee resource groups. I love the parenting one. That's perfect because so many parents are playing the role of teacher and helping their children learn. So think about how you can create opportunities for people to connect in employee resource groups around issues they're struggling with and that you can really support them with. And then promoting meditation and mindfulness. Next slide, please. So what I think is really important is for organizations to be asking themselves, what's available when it comes to access to our employees? We have an employee resource, we have a employee assistance program. Is it working? What does our data look like? What is our EAP vendor telling us? Are they telling us that our numbers are going up? If they're not, we have an issue. Do the employees know and are they consistently reminded how to reach out to the EAP? How many sessions are offered in counseling through the EAP? Is it 5? Maybe we should up it to 10. Really put your EAP vendor, if you have an external vendor, create a partnership with them to say, how are we going to work together on innovative ways to reach people? Digital options. So many of the digital apps now are being offered to employers for free or limited or lower cost. Things like Sleep, Mindfulness, there's Calm, there's Talkspace, there's Headspace. There's all these options that can be really helpful when people are home alone and need something to turn to. I'm going to talk a little bit more about the health plan in the next slide. If you don't have on-site care because you're not a large enough business to really think about having that, you might want to consider having on-site care as you transition people back to work. So you want to think about connecting to counselors in the community and bringing them in maybe for a few months. There are some organizations large enough to offer on-site care. We work with some of those large companies that say they started with one therapist and now they're up to 15. So if you can afford the space and the opportunity to provide on-site care, that can be very helpful through transitionary times. And again, continue to look at your data. Next slide, please. When you think about access to care, there's two areas. There are several areas in which you as employers have a lot of leverage as purchasers. So you work with a health plan, you work with a third-party administrator. They really work for you as an employer. So your benefits folks should be thinking about how is it that people are connecting to care now, given that we're not seeing many doctors in their office space. That's slowly changing, but for right now, what we did in 2 months is, as a nation, we stood up telemental health. So most people who have been getting mental health care have been getting it through telemental health. We have worked really hard at the American Psychiatric Association to break down barriers to people having easier access to telepsychiatry and telemental health. And it has taken a long time, but in 2 months, we proved that as a nation, we can do this. And there are many people who are very happy getting their mental health care through telemental health arrangements. So what we want to make sure of is we can sustain the momentum on that. So as an employer, as a purchaser of mental health care, you should really be talking with your health plan and your third-party administrator around how do we sustain the momentum that we saw happen during this time period while people were isolating and quarantining. How do we ensure that reimbursement policies remain in place, that we stood up to make sure that people could get access to care and payment was at the same level it was for office visits, whether it was through video or telephonically. People like choice in modality. Some people really like getting care through video connection or through audio connection. We want to ensure that people have the choice. Some people like to go into an office and they may never like that modality, but we really want people to have a choice. And really we need to keep thinking about quality. Also, when it comes to primary care will absolutely be on the front line of this second wave in this pandemic of mental health issues. We do not have enough mental health providers in this country to cover the need before COVID-19 came around. We are certainly not going to have enough now when more and more people are coming forward to get help. So we need to support primary care on the front lines. The collaborative care model has more than 80 randomized control trials to support it. It brings a psychiatric consult into primary care practices. Why does that matter? Because 80% of many psychotropic medication scripts are written in primary care, and we want to make sure that people are getting high quality care in a primary care setting. I did put a note there that we have infographics on the collaborative care model and on mental health parity to ensure that benefits are equitable for mental health as compared to medical surgical. So I would really encourage you to look at those infographics. They have very practical, easy to understand layperson explanations of the collaborative care model and mental health parity. Next slide, which I believe is my last. So again, creating a mentally healthy culture will be more important than ever. And what's really going to be important is that employees feel psychologically safe seeking help. We know less than half of people with depression get treatment. We really want to change that as we're moving ahead with more and more people experiencing these conditions. So I would say really ask yourself these questions. What is our leadership commitment to mental health, and is it visible? What are our policies and practices that really show our commitment to mental health? Have we made adjustments where we need to so that people can get access to care, they can attend to appointments, they have what they need to access care? Are we sustaining our focus and visibility? Let's not make this just about May as Mental Health Month. Let's carry this through beyond May And let's not just do one program. Let's make this really ingrained in our overall expressions of caring about employee health and well-being. Again, employee resource groups, more and more organizations are starting them. Really think about starting them. Mindshare is an organization that put out a wonderful resource on starting mental health employee resource groups. Do you have healthy work conditions? Are people working reasonable hours? Is stress level at a reasonable rate? Are you providing training and information sharing on mental health? And are you collecting and analyzing data with your EAP, with your health plans to show that you're meeting the needs of your employees when it comes to accessing care and providing them with the support they need to bring their entire selves to work, to perform at the highest level, and to meet productivity targets for your organization so that you can really meet your overall organizational goals in running a successful organization. So next slide is my contact info, and then I'm happy to turn it over to, oh, actually, I did want to mention, we put out a guide on workplace mental health and COVID-19 tips. That's available online, and I believe a link will be shared. So at this point, I'd like to turn it over to Jen. And thank you so much for having me.
Thanks, Darcy, and thanks, Eduardo. You know, I'm thrilled to be here representing Johnson & Johnson and sharing with you today a little bit about what we're doing. And, you know, Darcy, that was just a tremendous overview because it really provided me the opportunity to give everyone on the line today an overview of how Johnson & Johnson is doing some of those things that you mentioned that were so critically important to reduce the stigma, raise the awareness, and ensure that individuals can access the care that they need. So within my role, I'm responsible for employee mental well-being strategy as well as our workplace effectiveness strategy. So it truly is my privilege to work with the entire Global Health Services team and leadership team at Johnson & Johnson. Next slide. So as I orient you to the things that we've been doing, it is really important for me to start with, you know, our vision and really our purpose at Johnson & Johnson. And, you know, I heard this mentioned kind of as a theme as we began our conversation today, because we all know that, you know, a purpose in life and the purpose of what we do when we wake up in the morning as individuals is so critically important. And I can't underscore the importance of that during this time, especially having the privilege of working with, you know, in a healthcare organization. So at Johnson & Johnson, we truly, everything that we do blends our heart, science, and ingenuity to profoundly change the trajectory of health for humanity. And that seems like a humongous purpose for all of us each and every day. But I must say that it drives each and everything that we do. And I think as we're speaking about mental health and we're speaking about how COVID has impacted each one of our lives, it really does start with purpose for us. Next slide. And how we really speak to that is through our credo. So Johnson & Johnson's credo has existed since, you know, the very beginnings of our organization. And within our credo, and this is truly, if you will, you know, the charge that every individual that works for Johnson & Johnson abides to, is we have a commitment to the health and well-being of our employees and ensuring that we help them fulfill their family and other personal responsibilities. And I can't think of anything more poignant at this point in time when we are all impacted in COVID, by COVID within our workplace, but also within our personal lives. This is touching every aspect of everything we do as individuals. And so as employers, it's incredibly important for us to recognize that not only how this is impacting our work, but also how this is impacting our personal lives. And with that, I think the credo for us, because we have such a strong foundation in the commitment to the health and well-being of our employees, it was naturally something that we immediately drew upon and quite frankly really is our North Star with everything that we do at Johnson & Johnson, and even specifically around this time of uncertainty and high stress. Next slide. So when we think about that foundation and that purpose-driven, you know, mentality that we all, you know, work within at J&J, I think what I want to draw your attention to, and where Chris had asked me to focus a little bit of time, is around how we really manage the mental health and overall total well-being of our population. And we are fortunate enough to have many professionals working within our Global Health Services organization, as well as many platforms that we rely on. But what I want to focus on today, because regardless of whether you're a smaller organization or a large global organization like J&J, we do really have three fundamental goals that we really strive to achieve when we're talking about empowering and engaging our employees and their families to truly live longer, healthier, and happier lives. And that was regardless of COVID hitting us, right? So we had this commitment, and this is certainly our direction and our vision with everything that we do. So number one is our goals and our priorities are really around protecting and investing in the health and well-being of our employees, our communities, and our businesses. And that's really where I feel as though our three organizations on the phone today really are quite synonymous, right? We are all very much focused on our own employees. Eduardo, when you were talking about what you do for the AHA employees and staff, such a wonderful example. I've had the privilege of working with the American Psychiatric Association and Darcy. I know how much you do for your employees, certainly for the communities, as well as for our own businesses, right? In order to make sure that we function the way that we can to provide those services to, again, all of the communities that surround us. The second would be enabling and empowering employees to care for their health and well-being by pioneering innovative and personalized health tools and solutions. And I think this is really where I see a tremendous opportunity within today's environment. When I was listening, Darcy, to you speak about some of the things where you might be looking at your current services, maybe traditional services, and then actually asking those tougher questions during this time frame to say, are they really working effectively? Could we actually look at today's environment as an opportunity to peel back that onion a little further for mental health and really identify maybe even more innovation and greater abilities to personalize those health tools and solutions? And I'll talk to you a little bit about how we're doing that and how we're adapting at J&J. And then third, building a workplace culture of health. We have been committed to building a workplace of culture of health at J&J for decades. So I definitely will say that this is a longstanding goal of ours. But most importantly, again, I just want to reiterate the importance of our purpose and our purpose in what we do. Why it is that each one of us at J&J, 140,000 individuals around the globe, come to work each day. We're doing that because we want to change the trajectory of health for humanity. And so with that joint purpose and all of us driving towards that, it does give us the ability to ensure that we're kind of reaching this higher goal. And I want to say how important that is and critical that is during times of crisis, because that important comments that have been made around resilience and being resilient in times of change and times of uncertainty, that's when we have an opportunity to really draw on our purpose and then reach deep down inside into some of those strategies that, you know, we've either learned or we have the opportunity to learn to become more resilient during this time. So as we think about, and before I kind of move into some of the specific strategies, I do want to just highlight that we have many platforms at J&J, a lot of them very traditional in the OC health environment, where we have on-site professionals very much focused on safety and prevention. We also go very deep into a lot of our digital data insights and innovation work, and that has actually really taken on a whole new definition now that we are all virtual and working within virtual environments so much more. And then I'd be remiss to not say that we really are an integrated whole health. We have an integrated whole health strategy. So we're talking about mental health and well-being today, but it really is integrated into our physical well-being and all of the initiatives that we do. We focus on physical health and mental health. We strive to achieve parity, and we want to make sure that everyone understands that each one of those are very important. And certainly mental health at this point in time is just as important as your physical health. Next slide. Oh, this one might have some automation. Thank you. So as I think about and as I focus on that people-centered whole life approach, one thing that I did want to make sure that we talked about today and where I think has become very much a laser focus of ours is that we're not only speaking to our employees at Johnson & Johnson and their families about their work and how they're actually working productively, right? And how we go to work and stay healthy at work. But because many of those workplaces for individuals like myself who used to go on site for work and now work remotely within my home office, that has intertwined with their personal lives. So we also really have been very much recognizing anything in regards to an individual's personal life that we can further support them from an employer perspective. And then finally, understanding the communities. And a couple times on the call, I've heard the ERGs, the employee resource groups, mentioned. So I would suggest that, you know, we're not only looking at community externally in terms of the environment, but also internally. And how do we support employees, you know, foster those internal communities and then build those internal communities together. Within our ERG communities, we actually have 12 ERGs and one specifically focused on, individuals with mental health illnesses and creating awareness and reducing stigma around that. They're called our mental health diplomats. And we have had tremendous success with that community in ensuring that they can actually help us do that very important work internally. Next slide. So overall, what I hope you hear me saying with the overall, goals of our program is that mental well-being is not a nice to have, but a must to have here at Johnson & Johnson. And we all really do need to take care of our mental health the same way as we take care of our physical health. And Jennifer Bruno, this is her quote. She is our leader in global health services. And I think that it's just such an important quote that I wanted to make sure was very front and center for this presentation, because it's truly what we, our goals are in, at J&J each and every day. So let me tell you a little bit with the next slide, what it is that we're doing. And I think what you'll see with some of these are some of the key best practices that Darcy was mentioning. So first, I'll start with leadership support. And what I do want to emphasize is that not only are our leaders supporting the focus on mental health and well-being right now within the organization, in terms of each one of those meetings that they're having, they are emphasizing the importance of our employees and our leaders taking care of themselves and their families, making sure that that is a #1 priority on their list. That is spoken at the highest levels with Alex Gorski, speaking that, each time we have a town hall, all the way down to our section and our function heads and what they're doing. I would even say that our mental health diplomats, which is, the group that is our ERG, they're also going out as leaders from an employee perspective, right? To make sure that every single level not only is speaking to the importance of mental health and well-being, but also, to your point, Darcy, the empathy, the understanding, the compassion. Each day is difficult for many of us because change is hard. As human beings, we do need that connection. We do need the ability to understand that, you know what, today is a tougher day. And today is the day I need a little bit of support from my team members, or maybe because my family members need support. We're trying to open up that dialogue by really making sure that that leader support is communicated in front and center. The second is strategic collaboration. This is a critically important component. I'm one person on a team with Global Health Services. Global Health Services, you heard from me what the responsibilities we have for the organization, but make no doubt that we do that work collaboratively with all of the other key groups throughout our organization and with our business leaders. This isn't something only that falls within Global Health Services, that falls within the responsibility across our organization. Some of those key groups that we work with are diversity and inclusion. That is the team that actually is responsible for our employee resource groups. The other key partners we have are our human resources and our communications partners. We could not do a lot without them, because on a communications perspective, and I'll talk about that in a second, it's so critically important that we don't cause that information overload, that we make sure that we structure those communications strategically, and then we make sure we get the right information to the people at the right time so that they can make those decisions that are, again, important to themselves within their work as well as for their families. And then another piece I also want to highlight on strategic collaboration would be obviously our global talent management and our human resources partners. We have a responsibility at Johnson & Johnson to ensure that we have, that talent and that recruitment and, making sure that we are working as effectively as possible. that we can collaborate with them to ensure that our business priorities are front and center for us at Global Health Services. And then last, we're fortunate enough to have a global community impact team. So many of us know the value of volunteering and giving back. And that is part of our philosophy in terms of well-being, ensuring that if we have healthcare expertise, which we have so much of at Johnson & Johnson, we have policies in place and procedures to enable our healthcare professionals to be able to give back at this time, which will help them to really foster their own well-being. And then the last two pieces on this circle are effective communication. I talked a little bit about that with some of my points there in terms of my collaboration and our collaboration with communications. I would just say that one of our best practices in this is very quickly we created a microsite. It's called J&J Responds Microsite, and it is our source of truth. So Eduardo, when I heard you talk about making sure we got reliable information, what we did as an organization is we stood up a microsite so that throughout this entire time period with COVID, our employees can go to one location, find the reliable information, as well as direction for them that they need in order to operate every day. It's been incredibly helpful and one of the most important things that we've done. And then access to resources. I don't want to reiterate what Darcy said, but I will say that from our perspective, we are very, very focused on ensuring that we provide those appropriate resources that are accessible within the virtual environment, not only for home or at the workplace, but also for home if they need that, as well as a scalable approach that we can disseminate around the globe. And then those traditional services like employee assistance program, telemedicine, clinical services, family resources, we've made sure that they're available in a much easier fashion and accessible fashion to ensure that they're delivering the care, we're delivering the care that we need to our employees. And Chris, I think that was my last slide. Let's see. Yep. So at this point, what I wanted to just say is, again, thank you for the opportunity. And that gives you a highlight of what we've been focusing on here at Johnson & Johnson since, this pandemic hit. And we wanted to make sure that our employees could not only understand how important it is to pay attention to their mental health, but also have all of those resources and the support they needed to do so in the appropriate way.
Great. Thank you very much, Jennifer, and thank you to Eduardo and Darcy and the three of you for sharing your insights. It was very helpful. It was also very inspirational, and we have had a couple of questions that I'd like to present to the panelists. And the first question is for Darcy. The question is, can you give examples of what health plans can share with us to help us know if we're making progress?
Sure, great question. I think I would start with the CPT or billing codes for collaborative care. This is a model that we know is extremely important to help stretch the workforce. And your CPT codes will give you a sense, because most health plans have turned them on. The issue is they're not being used nearly enough. And what is really helpful is if you're getting data on your CPT code used through your health plan, if you see it's low, which you likely will, you can then ask your health plan to really promote the broader use of this particular model just because it is so effective. I think too, it's important, network adequacy is a major concern. So I wouldn't be at all surprised to learn that many of your employees that have attempted to access mental health care have contacted a therapist or a psychiatrist in the community and found they're not taking insurance, they have a 3 to 6 month wait, or they're not taking new patients. This is not uncommon at all, yet there are a lot of providers that are outside of the network because they're not being reimbursed at an adequate level. And there have been actually Milliman has done several studies looking at this reimbursement issue and found mental health providers are paid 20 to 30% less than other medical providers for comparable service. So what I would say is you need to make sure there are enough providers in your plan network for your employees to get access to care. And the way you can find that out, there are some employers that have themselves looked at their provider list their health plan provides for mental health professionals picked a few, made calls just to see, in fact, if those providers that are on the plan's network list are accepting patients. And they've been shocked to find that it's very, very difficult to find an in-network provider. So network adequacy is essentially important. So whether you as a benefits HR or other professional within an organization make those phone calls, or you can let your employees know if you are having issues connecting with, first, I think it's great to normalize and then let employees know if you're having issues connecting with providers in our network, let us know. We will go to our health plan and advocate for them to really expand their network. So I think those two things, network adequacy and the collaborative care model, are key. The other thing is you can look at things like the number of scripts written for antidepressants and other, of course, de-identified information. Look at your data in a way that won't compromise the privacy and confidentiality of your employees. But you can certainly look at factors like that. But I think the network adequacy and the collaborative care model are a really good place to start.
Great, thank you, Darcy. The next question is for Jennifer. As a supervisor, are there good opening questions to ask folks that historically have struggled with mental health issues? When we were working face-to-face, we had more access. So now that we're working remotely, how does one even broach the subject with an employee, and what's an appropriate and sensitive way of doing that?
Yeah, I think it's an excellent question, and it's actually a question that I get quite a bit internally, and I want to, Chris, answer that in a little bit more of a robust way. One of the greatest successes we've had at Johnson & Johnson is opening up that dialogue and opening up the conversation, making it okay. Eduardo, you mentioned it's okay not to be okay, that campaign. And I will just say that having that dialogue is incredibly important to set the stage for all employees, not just leaders. We've been doing that for, I think, 6 weeks now, and we're focusing on individuals about themselves. So first of all, if you're an employee, do you actually have the ability to recognize the signs of actually having maybe some mental health concerns, right? Do you understand what stress looks like, what social isolation feels like, what feeling depressed feels like? Sometimes we're much easier looking at elsewhere than we are at ourselves. So we've been really coaching on that, making sure they understand the resources, and then they understand how to make a plan, and a simple plan is actually a great plan. So in follow-up to that, the next conversation is, what happens when I'm worried about one of my colleagues? And what about someone on my team, or as a leader, someone that's reporting to me? And the first step that we recommend is just asking that question, how are you? I wanted to check in on you. Asking how are you, no matter who you're asking it to, is incredibly, the three of the most powerful words you can use. And you can do that regardless if you're worried that of somebody, if they may have had previous issues or not had previous issues, because many of us are all struggling with this current environment. And so asking that, how are you? And then secondly, waiting to hear what that answer is and being very respectful of what might come back. There are individuals that are very private, and then other individuals that are going to feel very comfortable sharing. Regardless of that, you as the individual leader asking that question, normalizing that, making sure that that's much more of a common thing to do, whether it be in group settings or individual settings, you're showing that caring and that ability for people to reach out when they need to reach out. So that was the first step that we have been encouraging all of our leaders as well as all of our employees to do, to care for one another openly, share their story. So if somebody has used a resource or they have a strategy that's worked for them, share what that is with others, because that's how we learn from one another. And then third, make sure you stay connected. So if this leader is concerned, don't only ask, how are you? Continue to check in, because at some point, if that individual knows that you care, they will reach out to you, or at a minimum, have the resources because you are aware of them, so that they could reach out to those resources independently, right? So that's how I would respond to that, Chris.
That's great. Thanks so much, Jennifer. We've got a couple of questions. I think we're going to have time for possibly one more, and this one's for Eduardo. The question is, do you have any insight into easing anxiety around coming back to work plans and best practices you are looking to implement upon return?
Yeah, I'll try to be really quick. I think one, employees, that is workers, are looking for their employers to exhibit all of the characteristics that we just discussed, up to and including concern about the safety and the perception of safety on the part of the employer. So signage that says, we want you to do the following things to protect yourself. Here are the things that we are doing to help make that happen. Examples would be hand sanitizers in critical locations throughout the workplace, signage that reminds people not to shake hands because we're all going to want to when we see people we haven't seen for a while, not in a shaming way, but in a just a reminder way. Bathrooms that are well stocked, also with signage that says soap and water is the best way to protect yourself. Cues on how to continue to think about physical distancing, up to and including removing chairs from some rooms so that you can't have more than X number in a place, and then positioning them so that there is the physical distancing. And lastly, I would say the reminder that masks are a way that you demonstrate how much you care about someone else. If possible, and when the supply chain gets there, having face masks available for those who forgot to bring one from home. I'll stop there. I think it's about demonstrating care, safety first, making it possible.
Great. Thanks very much, Eduardo. I want to be respectful of people's time. We're at the top of the hour. We did get more questions than we were able to answer, so I'm sorry if we didn't get to your question. Just to reiterate, we will be making a recording of this webinar and the resources available afterwards. And so we highly recommend that you use those resources, which are excellent. And I just want to thank our wonderful speakers again for their contribution today. Thank you so much for your time and for your thoughts. And finally, thank you very much to our participants. We hope you enjoyed this webinar. And thank you, and stay safe and enjoy the rest of your day. Thank you, everybody.
Thanks. Be well.
Thank you. Stay well.